Hi, my name's Emily. I'm going to be your nurse practitioner for this exam, okay?
Hi, Emily.
So we're just going to do some tests to assess your eyes, your ears, your nose, your mouth, and I'm going to take a listen to your lungs, okay? Patient appears to be a 60-year-old female, normal stature and weight. She's making appropriate eye contact. She has appropriate hygiene. Vital signs are as follows. Her blood pressure is 120/80. Heart rate is 80. Respiratory rate is 16. And pulse oximeter is 97% on room air. I'm going to check your vision, okay? So I'm going to use the Snellen chart. I have all my equipment to the side. Normally, patient would be 6 feet away for this examination. So I'm going to have you cover your left eye for me. Can you read the second to last line?
CFDHJ.
Good job. Can you read the lowest line?
LTFPH.
Good job. Can you switch eyes for me? And can you read the second to last line of that eye?
CFDHJ.
Good job. And the lowest one?
LTFPH.
Good job. Patient's vision is 20/20 bilaterally. Okay. I'm going to take a look at your scalp now, okay? All right. Patient's hair is equal in distribution, no signs of baldness, texture is soft, color is just normal aging pattern, brown and gray. Okay, skin appears to be warm and dry, no signs of edema, appropriate for ethnicity. Just going to palpate your face. Okay, any tenderness right here? All right. Temporal artery is intact. Can you move your jaw from side to side? Okay, temporomandibular joint is also intact. Any tenderness here? Okay, no enlarged lymph nodes. How about here, any tenderness? Okay, trachea is intact, as well as the thyroid gland. Okay, I'm going to have you close your eyes. I'm going to test the sensation on your face, okay? Tell me where I'm touching you.
Forehead. Chin. Right cheek. Left cheek.
Okay, sensation on her face is equal bilaterally and intact. Can you smile for me? Good. Frown. Raise your eyebrows. Puff out your cheeks. Okay, cranial nerves 5 and 7 are intact. Okay, just going to take a look in your eyes now, okay? Okay. Can you follow with my finger with just your eyes? Okay, EOM is intact, accommodation and convergence are also intact. I'm going to test your peripheral vision, okay? Just look straight at my nose. Can you tell me how many fingers I'm holding up?
2, 1, 3.
Good, peripheral vision is intact. Okay, I'm just going to take a look in your eyes now, okay, with my light. Just look straight ahead. All right, pupils are equal and reactive to the light. Sclera is nice and white. Conjunctiva are pink and moist. No signs of any like swelling or redness or lesions or styes. Okay, I'm going to move on to your ears. Okay, any tenderness on your ears? No. Okay. External ear is intact, no signs of redness or swelling or any sort of bumps. Take a look. Okay, eardrum is intact, color looks good, no foreign bodies, no discharge, no cerumen. And check on your other side now. How about this ear? Any tenderness when I press?
No.
Okay. This ear also looks good. No signs of redness or lesions or nodules. Okay. Looking in. Eardrum is also intact. No signs of discharge or redness, swelling, cerumen. All that looks good, okay? Okay. I'm going to test your hearing now, okay? I'm going to stand behind you and I'm going to whisper 3 numbers. I want you to tell me what the numbers are.
4, 5, 6.
Good job.
1, 2, 3.
Okay, patient's hearing is intact bilaterally on the whisper test. This is called a tuning fork, okay? What I'm going to do is I'm going to make it make sound. I'm going to put it on the top of your head. I want you to tell me if you hear it equally in both ears or more in one or the other.
I hear it in both ears.
Equally?
Equally.
Good job. Okay. This is another test I'm going to do with the tuning fork, okay? I'm going to make it make noise. I'm going to put it behind your ear. I want you to tell me when you stop hearing the noise. Okay. I'm going to do the same thing, but I'm going to put it next to your ear. I want you to also tell me when you stop hearing the noise.
Stopped.
Good. Okay, we're going to do the same thing on your other ear.
Stopped.
Good. Okay, patient has no signs of hearing loss. The Weber and the Rhine tests are intact. Patient heard the noise longer through air conduction than she did by bone conduction. Okay, we're going to move on to your nose, okay? I'm going to first test your sense of smell, okay? I want you to close your eyes and tell me what you're smelling.
Orange juice.
Okay, good job. Patient's sense of smell, cranial nerve 1, is intact. Okay, are you able to plug one nostril for me and breathe in? Good. How about the other one? Okay, nasal airways appear patent and intact. Just going to take a look in your nose, okay? Okay, no signs of redness within that nostril. No signs of redness within this one either. External nose is also white, no signs of redness or discharge. I don't notice any foreign body. Everything seems patent to me. Okay. All right. I'm going to check your mouth next, okay? Can you stick your tongue out for me? Good. Tongue is midline. Can you move it from side to side? Okay. Tongue strength appears good. Keep it out for me. Just going to take a look. Okay, no signs of lesions or nodules within the tongue. Can you lift it up for me? Okay. Hard and soft palate are both pink and intact. I see all teeth are intact. Can you stick your tongue out and say ah? Good. Uvula is intact with normal movement. Patient has no tonsils. She had a tonsillectomy. No signs of gingivitis. I don't see any bleeding. Oropharynx is otherwise also intact and pink besides the tonsils. Okay. All right. Next, I am going to let me just take a look at your neck here. Okay. As I said before, your lymph nodes are intact and skin is warm and dry bilaterally. Everything looks, sensation is intact. You can feel me touching. No signs of lesions or nodules, okay? All right, next I'm going to take a look at your back, okay? Okay, palpating your back. Any tenderness? Okay, respirations appear regular and easy. Posterior chest is symmetrical. No signs of tenderness. Any tenderness here when I press? Okay, T9 and T10 are intact with no tenderness. They're symmetrical bilaterally. Any tenderness when I press here? Okay, No tenderness above the patient's kidneys either. Okay. Just gonna call I'm gonna do what's called percussion on your back again. I'm gonna tap it. Okay, all areas on the posterior back are resonant to percussion. Can you say 99 for me?
99.
About down here.
99.
Good. Tactile for minus is intact. Okay. Skin is also intact on her posterior back and symmetrical bilaterally. Take some deep breaths for me. Good. Lung sounds are clear bilaterally on auscultation. Okay, I'm just going to take a look at your chest on the front too, okay? I'm going to palpate. Okay, any tenderness? Okay. Chest appears symmetric bilaterally. Respirations are also equal. No signs of accessory muscle use. Okay, I'm going to do percussion. On percussion, all areas are resonant. Can you say 99?
99.
Good. Tactile for minus is intact. And I'm just going to take a listen to your carotid artery and then to your lungs as well. Okay. No bruit is noted on the carotid artery. Any tenderness? Carotid artery is intact with a strong pulse. All right. Now I'm just going to take a listen to your lungs on the front, okay? Deep breath. Lung sounds are clear on the anterior chest through auscultation bilaterally. And then last thing I'm going to do with your neck, I'm just going to test the range of motion, okay? Can you extend your neck for me? Good. How about flex it forward, and then to one side, and to the next. And if you could just do one big roll for me. Good. Okay. Neck range of motion is fully intact. Okay, that appears to be it for your examination. Do you have any questions for me? Okay. Thanks so much.
Thank you.